much. Moving on to federal health officials boosting supply of the monkeypox vaccine because of a surge in new cases. They're up more than 30% in the last week alone. And our Tanya Rivero is here with the latest to control this worsening outbreak. Tanya, good morning. The numbers going in the wrong direction.
They certainly are. Good morning, Tony. There are now more than 14,000 cases of monkeypox in the U.S. And while the government is vowing to ramp up vaccine supply, many people at highest risk say they're still having a hard time finding appointments.
There weren't any appointments available, and so I found that pretty frustrating and maybe a little scary.
After waiting about a month, 20-year-old Edward O'Keefe finally received his first dose of the monkeypox vaccine at this New Jersey clinic Thursday.
Frankly, the government has dropped the ball.
To meet the growing rise in cases amidst a shortage of vaccines, the CDC is now encouraging 1/5 of the dose be administered just below the skin, arguing that will stretch supply. The White House says it will distribute almost 2 million doses to regions that adopt that change. CDC Director Dr. Rochelle Walensky admits there's still a lot the government has to learn about this outbreak, including the effectiveness of the vaccines.
We expect protection to be the highest 2 weeks after the second dose of the vaccine.
According to the CDC, 98% of monkeypox cases are in men, 93% among men who reported recent sexual contact with other men, and more than 60% of cases are among men of color.
We're not reaching men who have sex with men who are black and brown the way that we need to.
And now the numbers of infected children have started to rise. There are at least 12 confirmed cases of children with monkeypox in the U.S.
Children are at higher risk for severe monkeypox. It can even be deadly in very young children.
Dr. Gounder says the most likely source of exposure to monkeypox for children is through close contact with a caregiver. The government will also set aside an extra 50,000 vaccine doses available for cities with large gay pride events coming up. But it is important to remember, even though most cases are in men who have sex with other men, anyone can get this virus.
Anyone
Tony
can get it. The numbers are moving in the wrong direction.
Yeah, anybody can get it. But how difficult is it, Tanya, to get? Is there a way to explain that?
It is difficult. You shouldn't be overly concerned, but it can spread through infected bedding, infected towels, infected clothes. So just take precaution.
Yeah, so it's not necessarily just skin to skin when you're talking about bedding and clothes.
Don't share towels in the locker room, for instance.
All right. Vlad, mine's got my name on it. Tanya, thank you very much.
Tony.
Just making sure.